I'm Johnathan Friedberg here at CHC, and I spoke just earlier about advanced stage Hodgkin lymphoma and the use of risk-adapted and response-adapted approaches. Advanced stage Hodgkin lymphoma remains a highly curable disease, but if you use standard ABVD, approximately 20% of patients still relapse. There's been a lot of interest over the past several years to try to stratify patients based upon clinical risk factors as well as other risk factors. Unfortunately, these have not really been successful. We have an IPS score that remains predictive in the modern era, but it does not sufficiently discriminate patients to allow a true precision medicine approach. Recently, there have been 3 large trials that have looked at using PET scans to try to determine which patients need either to be escalated or de-escalated in their treatment. The SWOG 0816 trial treated all patients with advanced stage disease with 2 cycles of ABVD, and then if the PET scan were still positive, they were escalated to a Bayakop regimen. If the PET scan was negative, they simply continued ABVD. Long-term follow-up of this trial suggests that the progression-free survival for the entire group is 76%. And for the group who was PET negative, the progression-free survival is 79%. These are better than historical controls, but emphasize that even with a PET-adapted approach, a substantial percentage of patients are still having disease progressions. These data were recapitulated in the Raffle Trial conducted by the UK, and this was a randomized trial that treated all patients, again with 2 cycles of ABVD. Patients who were PET negative were randomized to either continue ABVD or eliminate bleomycin and get AVD. Those who were PET positive in a single-arm study were escalated to, again, a Bayakop-containing regimen. This study showed that you could safely eliminate bleomycin, but otherwise the results were very similar to the SWOG 0816 trial, where only approximately 80% of patients remain disease-free at 5 years. And finally, the German group starts with Bayakop and then is looking at de-escalation questions. When you do that, progression-free survival is clearly enhanced, but the impact on overall survival remains to be seen. Putting all this together, I think we're in an era in Hodgkin lymphoma where we'd like to do precision medicine, but we can't yet. And what I'd also like to emphasize is that the PET scans may be helpful in a subset of patients with advanced stage disease, but even with a response-adapted approach, approximately 20% of patients are experiencing failures. So we need better predictive biomarkers, and there are ongoing efforts looking at serum studies, tumor studies, as well as other clinical prognostic indices. Hopefully in an era with new treatments, we'll have better options for these patients that remain safe. And it's obviously a very positive time. This has been a great meeting. Thank you very much.